Oh, okay, good.
A check's for you.
All right, so we're going to go ahead and get started. I know that there's a couple of members of the media that indicated they'd be here, but we don't want to keep people waiting too long. So we will go ahead. My name is Nathan Maines. I'm with Communities and Schools of Pennsylvania. I'm the state director. I want to welcome all of you. Thank those of you that were here all morning for our key leader kickoff event and training. I think that there was some great information presented, and we're off to a good start. Communities and Schools is very pleased to be a part of the CTC effort and to be the recipients of the dollars from the Pennsylvania Commission on Crime and Delinquency that allow us to restart the CTC initiative here in the capital region. We think that this is a great opportunity to bring all sorts of folks together and collaborate in a much needed way, and look forward to the next couple of years. So at this time, I will turn it over to Kim Nelson from PCCD.
Good morning. The Pennsylvania Commission on Crime and Delinquency, PCCD, began supporting startup and implementation for Communities of Care in 1994. Communities of Care is a community action planning process that teaches communities to make data-driven decisions. And who's best to make decisions in any community is who's best to make those decisions by those people who live in that community, who work in that community, and who serve that community. And that's what's very exciting about the Communities of Care model. In building on Communities of Care, PCCD began in 1998 an evidence-based initiative. And that evidence-based initiative, in order to get it started, first of all, we had to confirm that there was a pretty a long-term funding source. And over time, it's been named very many different names, but currently it's the evidence-based funding. And that does support programs, evidence-based programs, recognizing the importance that it's very important to fund and follow through with validated programs, those programs that have been researched and have proven to show outcomes for youth. Because if you're not investing in something that's not actually affecting your youth in a positive way and addressing the problem behaviors, then you're really just losing your funds. You want to be spent in the correct way. PCD over time has been very committed to Communities of Care and to evidence-based funding, and then when you do that, you have to support that. You just don't hand out new programs to communities and say, here you go, put it together. So we've also committed ourselves to providing support for technical assistance, and Brian Buckar will speak more to some of that TA that's available in the state. I am very impressed today with what I saw the leadership up in the room earlier, and one lesson we have learned with any kind of implementation we have supported is that the key leaders, it's that support in the community that makes it successful. And I can tell you the CTC regional, the Harrisburg Capital Region CTC is off to an incredibly good start. The partners at the table were interested, they were watching, and they are committed to the process. So we wish you great luck, and we thank you for the time that you all, those key leaders have already put into the process, and I know I'll thank you for the future for all the time you're going to put into the process. Thank you.
Good morning. My name is Brian Bumbarger. I'm the director of the Evidence-Based Prevention and Intervention Support Center, Epicenter, at Penn State University, which is a project of the Prevention Research Center at Penn State. The Epicenter is the training and technical assistance provider for the Communities of Care initiative in Pennsylvania, and the Prevention Research Center at Penn State is the statewide evaluator of that initiative, having been evaluating CTC in Pennsylvania for over a decade. I want to add my congratulations to Dauphin County for adopting or reigniting this proven effective model for reducing poor outcomes for youth, including delinquency, youth violence, substance use, and school failure, and for simultaneously working to promote positive youth development in communities and to strengthen families and the very fabric of communities in Dauphin County. The Communities That Care model is, it's not just a grant. We're not here today to celebrate Dauphin County getting a grant. Grants come and go. This is the adoption and the commitment to a new way of doing business, a way that marries science and evidence to the passion and commitment of the key leaders that were here today, and to many other community members that we will be working to engage over the course of the next couple of months across the county. We've evaluated communities that care for over a decade in Pennsylvania, and we've found overwhelming evidence that when communities implement this community prevention planning model and they use it to identify priorities based on local data, and they address those priorities through proven effective or evidence-based programs, that they can achieve significant reductions in delinquency, significant reductions in youth substance use, improvements in academic achievement and school engagement, reductions in the influence of negative peer pressure. So we're excited, based on the evidence of the impact of Pennsylvania already, in the evidence of communities that care across Pennsylvania communities already. We're excited about the capacity and the prognosis for Dauphin County achieving significant improvements in the outcomes for children and youth in the communities across the county. So again, my congratulations and the best of luck to you.
Last Monday evening, children and youth gathered outside on Crescent Street in Harrisburg when a random shooting occurred. Bullets flew through the air. One of the victims, a 17-year-old female, is a student in the Harrisburg School District. She was struck in the back by a bullet, and she's still in the hospital in critical condition. And this morning, I actually received an email from her mother saying that the hospital has told them that most likely she will be paralyzed and unable to walk. Her brother, who was also shot in the leg, has returned home from the hospital. In 2009, the Pennsylvania Youth Survey, over 12,000 students in the 8th, 10th, and 12th grades reported one or more occasions of alcohol use. Nearly 1 out of 10 Pennsylvania students reported selling drugs in school. I can continue to cite more alarming statistics about our youth involvement with drugs and violent behaviors across the state, as cited from this survey, and even right here in Harrisburg. However, when we take a look at the reported drug usage and acts of violence reported out in our community, we must remember that schools are yet a mirror of our society. As the superintendent of the Harrisburg School District, we can't continue to think that problems faced in our homes and communities will disappear when a child walks through the doors of a school or into a classroom. We can't continue to think that schools alone have all of the responsibility or the answers to address all of the problems prevalent in our society. The problems that our youth encounter are problems that we, the community at large, must solve together. Over and over again, I've heard repeated and even abused myself the African proverb, it takes a village to raise the child. But I ask all of you today, how do we actualize these words? How can we really put meaning to this phrase? In order to address some of these social and emotional barriers to learning within the classrooms, the Harrisburg School District has implemented several academic programs like Responsive Classroom, PATHS, which is promoting alternative thinking strategies, and Peacemakers. We have counselors who work with children of incarcerated parents. We have social workers who make home visitation a part of their daily duties. We acknowledge that there are very real issues within some of our homes and communities that our students encounter which inhibit their abilities to learn and contribute to the frustration they feel in the educational environment. We understand the importance of and need to have partnerships with external agencies to not only support our students during school, but to provide a system of support for the entire family. We have begun and want to continue to build upon our community and agency collaborations. We appreciate the Communities That Care model. It offers many opportunities to provide and establish solutions to foster real change. Franklin D. Roosevelt once said, "We cannot always build the future for our youth, but we can build our youth for the future." With the CTC process, We can gather information and focus on the outcomes we want to see in the Harrisburg area, raising healthy youth to become healthy adults and productive members of our communities. As we look across the state, school districts are all feeling the financial impact and reality of our governor's recent budget proposal. While having funding to continue our academic programs is always preferable, having additional adults to provide one-on-one academic tutoring for our children, both elementary and secondary, is also a gap that can be filled in our school district. We continue to need more adults who would like to provide mentoring to our students as well. As students need advocates, many of our parents need advocates to help them navigate systems as well. So I am in favor of having coaches who would be willing to provide parental support and advocacy. With the data that we are receiving from the report, we can more adequately match adults to youth where the needs are. I heard someone once say a while back, "I must do something always solves more problems than just saying something must be done." So I encourage all of us today to become more involved and to be a part of any group or organization that is working with communities that care to garner and sustain support for our students and their families. On behalf of the Harrisburg School District, I thank all of you for allowing me this opportunity to share with you today. And thank you, CTC.
As the Communities That Care mobilizer, I'd like to thank everyone who attended our Key Leader orientation today. I appreciate your time, and I look forward to working with each of you to see how we can best serve families and students in the Capital Region. If you have any questions at all, please feel free to reach out to me. I'd like to thank Communities and Schools of Pennsylvania, the Epicenter, and all of the agencies that came to our Key Leader orientation today, and as well as PCCD for the funding through that is graciously going to help us move this initiative forward. Thank you very much and have a great day.